Dr. Harris, welcome to the You podcast, number 6, I believe.
This is very formal now because you've said Dr. Harris.
Yeah.
Not Dr. Dawn.
It made me feel quite nervous.
Number 6, yeah, let's do it again.
Number six. Okay. I am in the very fortunate position, Dawn, where I get to spend 4 days a week at our joint home in Perth at Kedras Clinics.
Yes.
But I'm really aware that people who are listening or watching the podcast won't know who you are. So I would just love if you would take a couple of minutes to introduce yourself, who you are, and why you're joining us today.
Well, right. Okay. So I am a forensic clinical psychologist, which means that I have sort of 2 hats on. So I work with people. Well, I don't work with them anymore, but I assess people who have committed crimes, and I write reports to help the court sentence them. So I work predominantly in the High Court, writing reports for individuals that are facing life sentences and very serious violent and sexual offences. And then my other hat, I work with people who have a history of trauma, so psychological trauma. So that's why I set up Kedras Clinics. But I'd like to take you through my journey about why I'm here.
Absolutely.
If that's okay. So I started on this journey to where I am today many years ago now. And it all started when I was a social worker. And then I was down in London on trying to climb the corporate ladder of Thresher's Wine Merchants. And I don't know if you two remember Thresher's Wine Merchants. I don't think you were, Maeve, because it's
I'm too young. I'm too young.
I don't know about you. Well, I was on that corporate ladder, and I was a victim of a really bad offence, an armed robbery, in my very first shop on my very first day. And as part of my recovery, I got to know a psychiatrist there who came into the shop, and it was him that told me to come back to Scotland and to go back into psychology, my first degree. So I came back up and I went actually back into social work, was there for 6 years as a criminal justice social worker, and then went back into psychology, and then I done some more degrees and a doctorate. So that brought me to working in the prison service, where I spent 9 years working with men and women who had committed serious offences, and I became head of psychology in a few prisons, and I came to the end of the road. So I went to private practice. I've been in private practice now for 14 years. And in that time, I have worked with people who've experienced trauma. And I had a hospital, I set up my hospital of my own, in which I worked with people with histories of complex trauma and personality disorders. And we worked out individuals' problems, not based on their labels, their diagnostic labels, but more on, how they were presenting to us. So it was a case of looking through everyone through a trauma-informed lens. So what happened to you? Not what's wrong with you. I don't want to know about your label. I want to know what's happened to you, the person that you are here today in the hospital. We want to get to know you, as opposed to let's just see you as another label. So that's what the hospital was all about. And I trained everybody in the hospital in understanding trauma, from the board to the cleaners to chefs. So everybody that met with those individuals could interact with them from a trauma-informed perspective. The hospital got sold. I came back into private practice. And then I decided I'd had enough of that type of life, stressful life, corporate life, everyone wants to call it. So decided I would just continue to have my own practice in Perth. I would go along to retirement. I'd have a nice little retreat somewhere, do that. And I would then just slowly go into where I live at the moment and just write a book or two and love life. However, I went to a conference and it just so happened that somebody sparked my interest in trying to, dip my toe back into the business world again, and to start to open up some clinics that, again, focused on working with people who've experienced trauma, or working with people who've experienced adverse life events that maybe don't see it as trauma, but their functioning has been impacted, and using, as Maeve knows, it's not new because it's been around for 50 or so years, but using a psychotherapeutic technique called neurofeedback. And that's why I set up the clinics. This is a long explanation to why I'm here and who I am, but it's quite a journey, and it helps you to understand, I suppose, what drives me, what motivates me, because I've been doing so much self-reflection over the years that, I think I've got to that point of just bleh. So that's why I'm here today. I'm really basically because I like helping people.
I've got so many questions already.
Yeah, there's so much to unpick there,
there is
isn't there?
so much to unpick. Do you want to go first? Or?
No, you can go first.
So I am fascinated by the latter part of that introduction, Dawn. So where you talk about having this vision of kind of calming down and gradually kind of relaxing into the real world again. And yet you're compelled, something compels you to keep driving forward, to keep making progress in kind of this other world. How do you personally square that? Because I think that would resonate with a lot of people who have a vision of how they want their life to be, and somehow either feel constrained, restricted, limited, or compelled to just keep going, and yet there's this friction. So I'm just curious on that point alone, and and lots of other things, especially about the criminal stuff, which is fascinating. But if we could start there, that would be amazing.
So what continues to compel me forward like
Absolutely.
this? You know what I think it is? I think it's probably, maybe other people will resonate with this, but I think it's all down to childhood. I think it's all down to the fact that as a child, I was labeled abysm. I was labeled somebody who was difficult and very opinionated and very determined. And I didn't particularly like the label of being abysm. And I think that from then on, I have tried to interact with the world from a place where there is no labels and where there are no labels. And I'm quite determined to continue to do that, because I think on my own reflections, I was sort of put into a box because of the way that I was perceived, and I became that person, not because it was who I was, but I became them. And so I think the compulsion comes from, I don't want anybody to experience what I experienced. I would like people to be able to come to a place like Kedras and to be able to be seen for who they are, as opposed to who people have told them they are, and to dig deeper into what drives them, what motivates them, and to help them to figure out, I suppose, along the line, what do they think in terms of their life? Where would they like to be? Where would they like to be if they thought, if we could actually address your childhood stuff, if we could go back to, we don't have to go back in terms of revisiting everything, but if we could work out what was driving you, what motivates you, how could we then change that so you could become the person that you probably always wanted to be, but never been able to be? Now, I'm not saying that we say to people, you've got to change. It's more about how can we make you happier within yourself? What is it that we need to help you to address, to understand, so that you can become that person that maybe nobody has allowed you to be before, including yourself. And so I suppose that's what compels me.
And I think the labels things drives me mad, because it's so static, right? It's really static, and actually life is dynamic, and it there's immense flux in life, right? Yeah. So even hour by hour, let alone week by week, month by month, you transform as an individual up and down, right? So trying to label that at any one point in time is irresponsible and really unhelpful, right?
And something you said there, Dawn, really struck me. And I think at U, we always talk about lived experience, and experience being a really important factor of what we do here, being really important, but something around change. And is change possible, or do we just want to become happier with who we are? And that not being labeled or a diagnosis or anything around that, but just being happy with the experience that we have and what's driving us. Yeah. I think that's actually really important, isn't it?
Yeah, completely. And I think you've hit the nerve, because I think it's about, we all don't like, none of us like change. Our brains don't like change. Yeah. We don't like change. We find it very triggering. So I think coming into something like therapy, people might think, well, they're going to try to change me, but it isn't about that. It's like Maeve, as you said, it's about trying to accept who you are and all those parts of you. And maybe what we do at Kedras, because we use neurofeedback, is we're working more on reducing anxiety, reducing those things that might impact on your functioning, that stop you being that person who you are. We're not saying reject yourself. We're not saying reject parts of you. or reject anybody in your, what we're saying is, let's just be with all parts of you, accept all parts of you, and appreciate that you are this amazing individual who has probably got through so many different difficult things in your life. Yeah. But, life is now causing you problems because you can't concentrate, you can't focus. Anxiety is getting in the way of you achieving something. Or it might be the case of, you can't sleep. Or those are all symptoms of I don't know, it's not necessarily something that's wrong with you. It's symptoms of life, the environment saying that maybe things need to be a bit different for you. And we need to calm down those stresses for you so that you can then grow, develop, become this amazing individual who you currently are and continue to get better.
Absolutely. And I had a great sort of mentor and role model in my life that used to say, all parts welcome.
Yes.
And I think that's a great kind of phrase that I've always kind of tried to play over in my head all the time, that, all parts are welcome all the time. No matter what those parts are, even if they're a little bit challenging or they stick out from the norm, they're actually, it's okay to have those parts. So you've talked a little bit about neurofeedback. So obviously I practice in the clinic with you, Dawn, so I know what neurofeedback is. Paul, do you know what neurofeedback is?
We haven't got the time for me to explain it to you, unfortunately. But what I'm going to do is let Dawn explain it for us.
So Dawn, it's been around for 60 years now. What is neurofeedback?
Wow. No.
Well, let's get the cake out and the tea.
Neurofeedback is one of the most amazing psychotherapeutic techniques I have ever come across. So I've been around for a long time. It's not a psychotherapy in itself. It's not a modality that stands by itself. It's a psychotherapeutic tool technique, I would call it. And what neurofeedback does is that, the particular neurofeedback that I use, and we use at Kedras, is called infralow frequency neurofeedback. And what neurofeedback does is that it is I would call it a digital technology, just like you guys are creating and great things in your world. It's like a technology that I think it's making great waves in the psychotherapeutic world. But what it does is that it actually analyzes the brain's own brainwave frequency. So if you're looking at a screen, a TV screen, the software that the therapist has in their computer is feeding the TV screen. And that software then literally interacts with the brain and its own brainwave frequency. So basically its own activity. So the brainwaves are just communication within the brain. That's all that they are. And what the software that we use does is that it actually shows the brain its own activity. We don't see that. We're just watching an animation or a film or whatever we're watching. But the brain actually sees its own activity. So it sees its own communication pathways. And as it starts to engage with itself more, just like we would do looking in a mirror, it starts to change based on the fact it doesn't particularly like what it sees. So neurofeedback is about your brain seeing parts of its own activity as being under-aroused or over-aroused and changes it. And as a consequence, you start to naturally calm down and stabilize just by looking at a screen. Because it's like when, and we talk about this in the clinics, it's like when you walk past a mirror, when you look at yourself in the mirror, you might adjust something about yourself based on the fact you don't like your hair might be out of place, or, or an eyebrow, or your mascara's run a bit. And you would then change that. And then you think, oh, actually, I look better. The brain does the same. The brain has an inherent ability to heal. It doesn't like being off balance. It likes to be balanced, and it loves to control its environment, loves it. All the time, it's looking around the environment, what can it control? And then it will interact with that. So neurofeedback just literally takes that theory and uses it. So when the brain is looking at itself, it then starts to adjust its own frequencies, basically, its own communication pathways. And consequently, the person who's watching the TV screen starts to calm down. So their anxiety goes down, their tension goes down. They feel better. They feel calmer. They feel more stable. Their thoughts can start to reduce, ruminating thoughts can start to reduce. Their voices can go down, etc. as the brain starts to calm itself down. So it's an inherent ability to heal.
And just to give Paul an idea, I've worked with people who maybe on the first day of having neurofeedback sleep better on the first time of having neurofeedback,
Wow.
which we don't see often in regular, routine therapies.
No,
So it's a
absolutely.
really incredible type of psychotherapeutic
I
tool.
love that idea of looking in the mirror and making adjustments. I mean, and that's so simple to understand for the layman. And it sounds like it's super impactful.
It's a very powerful tool.
It's an incredibly powerful, and Maeve's right. People can see differences after one session. And I can give you loads of examples, but I've had teenagers in here who've had voices that have calmed down on the first session. We've had people with huge amounts of anxiety go away feeling calmer after their first session. I've treated people with ADHD, ADD, OCD, personality disorders, complex trauma. And there isn't one person that I have worked with who hasn't had some sort of an impact working with neurofeedback with me. But I think there's various protocols to use in neurofeedback. You can have this first stage, I suppose, of you calming down the body, so calming down sensations in the body. You calm down mental thoughts and rumination and racing thoughts. You calm down emotions and emotional reactivity to things. But the second stage of it is you then use something in ILF neurofeedback, so infrared low frequency neurofeedback, called synchrony, where you, again, it's an amazing, powerful thing as well. You're literally looking at the screen and the brain starts to actually like what it sees more. So as a result, you start to accept all parts of you more, and you start to enjoy being around others. Now, anybody who's experienced any problems with themselves in any capacity will know that it can be very difficult to interact with people when you're feeling low, stressed, you're not sleeping, you're irritated, everything's on top of you. What goes first is your relationships with others. And the people who get it most are your loved ones. The people that are closest to you will get your most irritation. And as we calm the brain down, that does improve. But the best relationship, I always say to people, the best relationship you're ever going to have is with yourself. See, once you've got that, everything else is so much easier and better. So what happens is we don't necessarily talk directly about, when you go home, think about talking to your partner, spouse, children like this. I use synchrony a lot, which in itself helps the person to like themselves more, which is what we were talking about at the beginning of this podcast. As a result of them starting to like themselves more and all parts of them, they start to see the world completely differently. And I'll give you an example. I worked with somebody, and I know she won't mind me sharing this because I have a video of her saying this with me that I use online. And she would say, when she came into neurofeedback, she's a very, very clever lady, highly articulate, very high functioning. And she said, every time we went on a Zoom call with my husband's friends, they're so clever. They're professors at universities and they're so clever. And I always felt really stupid. Now, I could have spent years saying to her, you're not stupid. Let's look at why you're not stupid and let's look at everything you achieved. But it's going to be working with the wrong part of the brain. So neurofeedback works within the depths of the brain. So it works in the limbic system and lower, even in the, lower in the periaqueductal gray. We won't go into that, but it can work lower. And as a result of that, it's working in the areas of your brain in which the problems are. So we done a lot of synchrony with her, and it worked on those parts of the brain that are about attachment. And afterwards, she would say to me, after her second session of synchrony, she said to me, we had a Zoom call with my husband and his very clever friends. And she said, for the first time in my life, Dawn, I realized I'm just as clever. And now I can talk to them more. I don't now stay quiet. I actually have an opinion with them. And you know what? They listen to my opinion. And I hadn't done anything. I'd just done synchrony with her. So it's incredibly powerful. It's
There's
great.
So many synergies, Dawn, between, you understood, what we're trying to emphasize is understanding yourself as much as possible and being comfortable in that skin and whatever hat that is,
that consciousness, isn't it?
That consciousness, because if you can be the best version of yourself and feel the most comfortable, then you're going to interact with the outside world in a much more positive, meaningful way. All parts, right? And so the synergies are fantastic.
Yeah. Yeah.
And I think you're right, because I think that individuals with mental health difficulties, or any difficulty, doesn't have to be, some people would say, I'm stressed at work, and not necessarily see that as a mental health problem. And it's not. It's because you have external stressors that are creating a difficulty for you. But a lot of people, for some reason, don't want to go and visit therapists or GPs to say, this is how I feel. And there is still the stigma. I know we've had this, media talking about, it's okay to have mental health problems, etc. But we still continue to deny ourselves the ability to heal and the ability to say, we can stand up and we have problems. I don't handle stress very well, or I have been stressed, or I'm really depressed, or I can't sleep, or I find I can't communicate with people, and that's okay. You wouldn't stop saying I've broken my toe or my foot.
Yeah.
So, it is about us. And as you say, Paul, it's about us saying, I have parts of me that I don't particularly like, is what you were saying, Maeve, before. I mean, I've got a abysmal part of me, but she's still me, and she remains me, and she's probably driven me and got me to where I am today, and been successful.
Absolutely.
This is really spooky, because I remember a conversation with somebody possibly 3 to 4 years back, and it was a game-changing conversation, and it was almost part of a throwaway wider conversation.
Sure.
I had, up to that point, battled, Dawn, with what you're saying. So I had always struggled, because I always felt that there was immense pressure on me to be a specific number of individuals. So an employer, a provider of service in the business world, a friend, a husband, a father, a sports person, and all of those hats, I felt, sometimes were conflicting with each other and creating tension, creating stress. And I remember part of this conversation, it's so funny you mention it, because I'd thought about them independently up to that point. And somebody said to me, but they're all you. Like, what's the friction? I don't understand. They're all you. But up to that point, it sounds simple. And when you're thinking about it in the world that you guys are in, it's clear, it's obvious, right? But I think, using me as an example of kind of Joe Public, if you like, I honestly hadn't thought about it in that way, and I was in my mid-40s until that realization said, hold on, I can look at this in a different way that's actually a more positive way to look at it, right? And so bringing that realization, raising the awareness that this isn't abnormal and that this is something that can be looked at through a different optic, I think is really important and really helpful conversation to have for everyone, right?
Yeah.
And I think, Dawn, I don't know about you, but I think some of the clients that I see, I think having that separation actually causes more harm than good. And I think once you start to bring all those pieces together and have that sort of realizing moment where you say, actually, these are all part of me, and it's a good thing, and that actually brings healing, like you say, like that's actually a really healing moment when you have that kind of epiphany, if you like. They're all part of me, and that's actually all right. And people might like you for different parts of you, but that's actually all right too, because that's on them, not you.
Yeah, completely and utterly. Yeah. And I think that's what I love about, doing therapy. I love it when people get that realization, have that epiphany, and accept all those parts of them, smaller parts, adult parts, teenage parts, adolescent parts, all the parts that we have had throughout our lives that we've tried to maybe suppress, put away, hide from. We're like, well, as you say, Maeve, if you don't like it, then that's who I am, and that's me. And I don't want to change because you don't like that part of me, because, well, how's that going to help anybody? You then could leave my life and I've changed for you. So, well, where does that leave me? Because now the next person that comes along doesn't like me anymore.
That's
because
powerful.
You changed me. So it's about, you need to remain consistent in who you are. And then once you start to love you, and I know people say it's a cliche, but it is about having that relationship with yourself, all parts of you.
Authenticity, right?
Absolutely. It's like a jigsaw, isn't it? We're like a jigsaw. And all those pieces of the jigsaw, we've got to have them there to create that whole. And if we throw some of them away, our jigsaw's not whole. And we will notice as we're interacting with people that we're not, as you say, Paul, authentic. And we'll feel it. Even though it's at a subconscious level, we will feel that and we'll know something's not quite right. But I think that the ability sometimes to articulate our problems can be very difficult, particularly if you've experienced trauma or adverse life events. We know from neurobiology that we can use the capacity to talk about things and understand things. We lose the ability to have words. So Broca's area on the left of your brain can be affected. And as a result of that, you can really struggle to be able to say, this is what my problem is, because really sometimes you just don't know what the problem is.
And just to pick up on that point, Dawn, we talk a lot in our practice about how trauma is stored in the body.
Yeah.
So if you lose the ability to talk about, how you feel, you might actually store that tension, that trauma, that anxiety in the body. And I was trying to explain to Paul earlier on about what that might mean, and it just saw the blank look in his face. So maybe you'll have better luck at explaining that to him. But what do we mean by that kind of inability to express, maybe verbally, but maybe the ability, maybe that's all been held in the body somewhere?
Yeah, the ability to express things is, we know from people's experience clinically, and we know from the literature that, the body and the brain, they're communicating all the time. We know this, we know the whole bit about the vagal nerve and where that goes. It goes into the gut, etc. So, and for example, we know that 95% of serotonin sits in your gut. So we know that then that goes up to the brain. So serotonin, as in the hormone associated with mood, is sitting in your gut. So if you're having a problem with mood and like depression or anxiety, you're going to feel that within your gut. It's not in your brain necessarily, it's in your body. And if you ignore it, what will happen is that sensation will continue. And what you will do will try to fight it, deny it, ignore it, and think, oh, I'll take a pill, or I'll go to the doctor, or I've got a stomachache. But in actual fact, your body is your main vehicle of giving you a message that something isn't right. Your brain can take you here, there, and everywhere. It can take you in mazes. It can take you down the wrong path. You can play around with it. It can be manipulated. But you see, your body, it always holds the truth. That is where you go for the answer. So I've got a great saying. I say to people, ask your body, not your brain, what is wrong today? Or ask your body, not your brain, what would you like to do today? And what that means is you need to drop into feeling all parts of your body. And you will find that as you do that, sensations will just come up that will give you a message about what it is that you might want to talk about that day, that earlier on your brain had not given you an answer to. But when you ask the body straight away gives you an answer. So the body talks.
So Dawn, this is resonating with me as well. I remember when we first started our journey, there was, we told a story a lot about humanity, if you like, in this day and age, but a gradual evolution to this point, being further disconnected. So disconnected from ourselves, disconnected from our relationships, disconnected from the environment, from where we came. So this kind of great mass disconnection, and the ways that play out, and you touched on some of them. When we think about the connection to ourselves, is you can see it play out in a number of ways. So when we're tired, we won't go to bed because there's something exciting on television. So we're actually ignoring our bodies telling us. Or when we're full and satisfied from a food perspective, there's still some food on our plate, right? And actually that dessert looks quite nice over there. So I'm just going to keep going, right? And even though the body is telling us, actually, we're good now, right? So I feel like that's just one example, and you're emphasizing it. But we've just lost connection. We're kind of disconnected from so many things, and it's bringing that self-consciousness back, that self-awareness that enables us to be the best version of ourselves, right?
Absolutely. And I think you're so right. And there's various levels to this and various ways of looking at this, because I think society and the way that we live now has made us disconnected because of the fact that we are so fast and furious in the way that we live. And maybe I shouldn't be saying this, but in terms of social media, I think social media has had a huge impact because
Agreed.
we're
Yeah,
creating
agreed.
a generation of children that cannot communicate.
Yep.
Yeah.
Apart from on a laptop or a computer or a phone. They have lost the ability to actually verbalize and talk to their parents, their peers. And I think that's a massive disconnect of us as social creatures. We are social creatures. We
Yeah.
need to be around other people. We need to engage with them. We need to feel them. We need to talk to them, not type a message. And I think that's
Yeah.
created a massive disconnect in our society. But I also think because of the pace of life, we have got used to, as you say, Paul, ignoring our bodies and just carrying on. And, you know, those stress executives that just keep going,
Absolutely.
keep going.
Yes.
The bottom
Badge of honor, right? Badge of honor. Yeah, yeah.
Absolutely.
and it keeps, and you just lose your body. And then then over and above that, if you have a traumatic event, we know that a lot of people will numb out their bodies as a way of survival. Survival is about, if I don't feel my body, you can't hurt me.
Right.
Yeah.
If I don't feel my body, then I don't need to know or recognize that there's something wrong. I can just ignore it. But your body will continue to give you these messages that there is something wrong, be it through anxiety, be it through fibromyalgic pain, be it through chronic pain, be it through back pain, be it through other types of, you know, body sensations that somebody might get, be it that they really struggle with arthritis. These are all things that we know have got psychological basis to them. And that is the body saying, no, I'm done. I can't do this anymore. And you need to start listening to me.
It's
Because
about tuning in again, isn't it? Yeah.
it absolutely it is.
Yeah.
And we don't do it. And if you ask ask any of your friends, how much do you know what's going on in your body? No, I don't exist from here down.
And so you've been in this world now for a considerable amount of time. I'm always really curious to know, you know, you touched on it there again, but have you seen an increased prevalence of these challenges in society today versus, you know, back 15 years ago? I mean, is there a tangible difference between a very short period of time when you look at it?
Yeah, I actually think that there has, Paul. I really do. And I actually think we're very unwell as a world, as a nation. I really do. And I think that that's another reason that I decided to open up Kedras Clinics. I could not keep up with the demand, and I could not keep up with the complexity of difficulties that people were presenting with as well. And, you know, a lot of people's problems, if you look at it in terms of a common theme, and you'll see this, Maeve, it's relationships. Relationships,
absolutely. Attachment and relationships. Yeah.
Huge. And we know that there's the paradox of healing, which is relationships have hurt me, but relationships are also where I heal. So how do I balance that paradox? And I think in this society, we continue to encourage disconnect in relationships. And yet that's where we need to be to heal, to be warm, nurturing creatures. And we can't do that if we're continuing to be encouraged to watch TV at night, to watch all these strange things that are on TV, and to engage in computers and laptops and video games, and that's not helping our growth as a human race. And I think I've noticed that in terms of therapy.
And I would say as well is that the sort of challenges that we're seeing at the clinic, and actually that we're seeing on the whole, are more extreme. As well. So you're not just being approached by, like, I work with children and young people, so I'm not just being approached by children and young people with problems I would have seen as a child. They're now in the more extreme, you know, of ends of things, and I think that's proving that this is a very unwell world that we're living in. There are more extreme problems with more complex realities.
But surely part of that challenge and the answer to that challenge, to some degree, is trying to flip the thought process from reaction to proactivity, right? So to prevention, because otherwise there's a tidal wave of necessity around remediation, support, and can we genuinely address that in a meaningful way? Can we really provide help and support at the volume that's expected if we don't start to look at preventing that tidal wave in the first place. And that's, I guess that's a real concern of mine, is that we kind of need to stop or try and prevent people crossing over into crisis.
I mean, I think that's always been you understood, ambition is to be, or aspiration is to be preventative, and not prescriptive, and not at crisis, but preventative. And I think, we're seeing huge numbers at the clinic in terms of waiting lists and things, which shows you that it is crisis. For a lot of people, but prevention is absolutely where the direction should go.
Definitely. So could you just give us a few minutes on the direction of Kedras Clinics then, and the vision that you have, and how you think that will play out in the next few years?
Yeah, I mean, I'm hoping that, we continue to go. So the first clinic is in Perth, and then hopefully the second one, we're aiming to be in Edinburgh, and then so on. And, as we start to grow throughout Scotland, and then maybe down into England and the Channel Islands, and if I get my way into Europe, and potentially South Africa.
Bags of Europe.
And South Africa, because my husband's South African. But that's where I'm hoping, because what I'd like to do is that we now have, I'd like Kedras to be a psychotherapeutic practice with a difference. I think we've got a lot of psychotherapy practices around that do a very good job. I just have always been somebody, it's that BISM again, driving forward, always been somebody that's ahead of the curve for as far as I remember. And I think that's why I've come here to this place. And I'd like to be ahead of the curve again. And I think that is going to be about a combination of digital technology combined with psychedelics as we move forward. Because I think that one of the main difficulties in therapy is obstacles that people have, which is fear. I don't want to talk to you about my issues. I don't want you to see my shame. I don't want to cry in front of you. I don't want you to go to this deep, dark place that I try to stay away from all of my life, which is why I now have difficulties in my body and my brain. I don't want to do any of this. So you spend a lot of time trying to overcome obstacles. Now, using ILF neurofeedback within the practice means that we can get through those obstacles a lot quicker, because we're working at the subconscious level, which is where all the obstacles sit. So that's why I decided to introduce it. And then psychedelics will do the same thing, because they're working when the neural pathways are open, and you're able to then use psychotherapy to really help that person to be able to change and have a different perspective on things. So that those obstacles that were there have been removed by using neurofeedback and psychedelics. But I'm not saying that they bash through everything. It's sort of very gentle, really, but it's powerful. A powerful experience. So I'd like Kedras to always stay ahead of the curve. So introducing neurofeedback and psychedelics is the first thing I'm going to do. Having therapists like Maeve and others who really understand people at a level that I think is more than just a clinical level. It's a human level.
Absolutely.
And that's what I'm really wanting from the therapists. And I know one of my future questions when I interview therapists is, what can you feel in this room with us today in this interview room? Because I want people to be able to feel those individuals that are in the room with them. That's really important to me. So I think those things, and having therapists that are really enthusiastic about Kedras, what we're doing, see it as a family. I'd like Kedras to be a family growing together and having us all involved. It's not a case of it's a hierarchy, but it's a case of we're on this journey together. So let's see how we continue to grow it, evolve as a family, and having different roles within that. That's another part of Kedras. And then, of course, I'm using You Understood, amazing app. To help me to be able to collect data, because I think research is really important to me. And again, this is very, very different to a lot of psychotherapeutic and psychology practices. They're not interested. I'm not saying it's because they're not interested, but they just maybe not have the time or thought about it. But not many people integrate research or collection and collation of data into their practice. And I'm trying to make a difference, which is we're going to start doing that. We're going to collect data, collate it, and analyze it. Using the You Understood app as well as other databases, because I think that that's really important to be able to say to people, I'm not just saying to you that we're different. Here's the data. You can't lie with data, and here it is. And also, I think, if you're paying for something, you need to know that it works, don't you? You don't go and buy a TV and say, well, I need to know that this is going to work. I need to see the data behind it, or I need to know that when I'm spending this money, that I'm getting something for my money.
It needs to be evidence-based, right?
Absolutely.
Yeah,
Has to be, has to be. And I think
and that
sorry.
empowers you, right? That
It
empowers
does,
you
yeah.
further. So you can take that evidence, you can take that data, and you can say, how do we continue to improve? How do we continue to go on the journey? And being at the leading edge is a multitude of things. It's brave, it's challenging, and sometimes it can be lonely.
But it's also exciting.
But it's also exciting, absolutely.
Yeah.
So, huge admiration, and I applaud you for taking that stance, because without being brave, without pushing boundaries, without innovation,
without being a mover and shaker,
you stand still, right?
You
Mover
stand
and
still.
shaker, I
Mover
like
and
that. I'm going
shaker,
to use
yeah.
that. Absolutely. So, I mean, it sounds like hugely exciting, And are you able to enjoy the journey, or is it actually, damn it, I need to hit this milestone and this milestone? Because I certainly, from previous experience, when I look back now, I wish I'd have kind of paused a few more times and just sat back and enjoyed it, actually been in it versus being kind of part of it, if that makes sense.
Yeah, I completely agree with you, Paul. When I set up the hospital, I was far too in it to be able to enjoy any of it. I'm trying to learn from that, and trying to do things a bit differently with Kedras. I'm sort of in both camps at the minute. I'm sort of like being a bit overwhelmed and really busy, so I'm not enjoying it as much. However, what I have done is Friday nights, and Maeve will probably know this by now, but Friday nights are my night of relaxation, where I have champagne every single Friday night.
Good for you.
With my husband. We sit down, we talk about the week, and we talk about where we are, where we're going, and that's all we do. There's no TV, there's nothing. It's just a night of just the two of us sitting around either our bonfire or whatever, in a hot tub, whatever, and it's just our time to relax, but it's also our time to reflect. So the two of us reflect on our weeks, and Brad, my husband, he tends to sort of talk me through everything to do with Kedras, because I can move at the speed of lightning, and I need to be calmed down. I've spoken to you guys about this, and I think he's a very calming influence, as well as other people around me. And I think that's an important part of my learning. I've learned to sit and see what's happening, as opposed to, as you say, Paul, right, I need to get the next one clinic. I need to get the next therapist. I need to hurry up and do it. I'm like, no, I need to just chill and just.
And sometimes going slower, actually, believe it or not, I think enables you to move faster. And when you try and do all those things that it sounds like you and I have been trying to do for many, many years, actually it becomes so overwhelming that all of a sudden you stop. You do get that stop, that pause, and it may be enforced, or it may be something you're able to do, but you realize, my goodness, there's so much going on here. I'm actually not achieving anything. Whereas if I just slow down and do this one thing, that might only represent 2%, which doesn't feel good, right? To you and I, 2%. Goodness, that what rubbish, right? But guess what? It's progress. And
it's quality progress.
It's quality progress. And if you achieve something, it enables you to move to 4 and 10%. But you can be overwhelmed with, there's so much I need to do here, and actually achieve absolutely nothing. So it's really important to slow down. Yeah,
I completely agree.
There was a great book called Think Fast, Think Slow.
Yeah. Okay.
So you are such a reader. I'm
such a reader. I read everything. So I recommend it to both of you.
I'm still on Roger Red Hat.
You're still on Roger Red Hat. I know I gave you a book last week to read, pop quiz this morning, and you missed it.
It was true. Yeah, sorry, can I say one more thing? I know,
of course.
Is that on this basis, is that I was talking to somebody recently who was in the military, and he was talking to me about military strategy, and he was talking to me about somebody called John Boyd and the 4 elements. I don't know if you know of John Boyd's military strategy, and it's sticking in my head now. I'm thinking, am I doing that? So he said the first one is to observe. Mm-hmm. The second stage is to orient. The third stage is to make a decision. And the fourth is to act, and then you start the loop again. So you observe,
orientate.
you decide, and then you act, and
I
then you
like that.
Love it.
I like
so I'm
that.
like, every day I'm like, am I observing today? Am I orienting? What am I doing? And I'm trying to put myself into this nice structured framework. So I'm hoping that will help me, my thoughts racing everywhere and my, 100 million miles an hour. That's going to sort of contain things a bit for me. So we'll see.
And sometimes people get stuck at the making a decision phase because they're worried about, is that going to be the right decision? But I always say, make the decision, and if it's the wrong decision, then at least you know through evidence that it's the wrong decision, and you can circle back round to those other phases and reapproach it from a different direction. But if you get stuck at the decision phase, whether it's right or wrong, then you're in trouble, because you could stagnate there for a long, long time, right?
But some people also get stuck at the observance phase and just watch the world go by, and never ever get to the orientating themselves to make that decision or to, so I know lots of people like that. I'm whizzing past them, and they're like, you standing, just watching the world go by. Anyway, I shouldn't get into that. Dawn, we are so thrilled to be part of your journey with Kedras at You Understood, and even more thrilled that we've had this hour to speak to you. Thank you so much for coming in. And Paul thought he'd had nothing to say, and he hogged the mic the whole time. So,
I'm surprised I didn't get switched off at some point.
So thank you so much.
It's been great to talk to you guys. I'm really excited about our journey and going forward with your app and Kedras Clinics. It's going to be amazing.
Absolutely. And the sun's still out in Perth, so have a lovely day. And I'll see you in Perth very soon. All right. Take care.
Cheers.
Bye.
Bye.
Bye. Bye.